Hello, everybody, and welcome to today's presentation. Thank you for waiting. My name is Tista Bhattacharya. I am one of the co-directors of the Action Potential Advising Program here at Simply Neuroscience. And today I am joined by our moderator, Deena Khan. She is also the co-director of the Action Potential Advising Program. And it is our greatest honor to introduce to you Ms. Drushti Naik, who is going to be giving a presentation on the topic Parkinson's disease, current and future prospects. Drushti Naik is currently pursuing her MTech integrated degree in biotechnology with experience in neuroscience, specifically Parkinson's disease and the handling of Drosophila melanogaster. Drushti wants to continue in the field of research and is passionate about sustainability. Now, before we go ahead, a couple of quick housekeeping notes. Please send in any questions that you might have in the chat after the presentation is over. We will be keeping around 5 to 10 minutes for Q&A at the end of the presentation. Also, I must ask to please refrain from unmuting yourself during the presentation. Also, everyone, friendly reminder that this session is going to be recorded. If you do not want your face or your voice to potentially appear in the video recording, please turn off your camera and microphone and feel free to use the chat. And now, without any further ado, let's get started with the presentation.
Thank you so much for that introduction, Krista. And just give me a minute, I'll just share my screen. Is my screen visible?
Yeah,
Yeah, cool. So let me just get started then. So hi guys, my name is Drushti Naik and I'm going to be presenting a presentation on Parkinson's disease current and future prospects. And so first we're going to start with just a second. Disclaimer actually. So the first clear medical description was written in 1817 by James Parkinson. Approximately 1,97,000 people are treated with PD worldwide, and that is why it is the second most common neurodegenerative disease in the world. With 59% of patients receiving treatment in developing countries and 41% in developed countries. There is no homogeneous and large epidemiological data of PD in India. According to a report, there are 60 over the age of 60 years, a high prevalence rate was reported for Parsi people, a very small community in Mumbai, and the report suggests upon 1 lakh people, which is pretty high for India. So now neurotransmitter dopamine. So what are neurotransmitters? Neurotransmitters are chemicals made by nerve cells called neurons. They are used to communicate messages across different parts of the brain and between the brain and the rest of the body. So here, as you can see in this picture, the synaptic vesicles, they are producing these dopamine, these neurotransmitters, these chemicals. And here on the bottom level, this is another neuron, and here there are dopamine receptors. So this dopamine from the synaptic vesicle will come and join the dopamine receptor. Dopamine is involved mainly in controlling the movement. So when the production of dopamine reduces, it can lead to Parkinson's disease. What is Parkinson's disease? So as you can see in this picture, this is the picture of the brain, and here this blue part is the substantia nigra area. Substantia nigra pars compacta is the area which is affected most by PD. Here there are the neuronal death rate is increased a lot because the dopamine production decreases. Here in this picture, as you can see, As you can see here, healthy neurons of a these are the neurons of a healthy patient, and these are the neurons of an affected PD patients. In the healthy neurons, you can see that the dopamine being received in the dopamine receptors is so high. But here, as you can see in PD, it is affected, and the dopamine level is reduced a lot. Parkinson's disease. So, Parkinson's disease is characterized by extensive dopamine neuronal cell death in the brain, especially in the substantia nigra pars compacta region. It is the second most common neurodegenerative disorder after Alzheimer's. Parkinson's disease is a long-term degenerative disorder in CNS that mainly affects the motor system. By the time an individual is diagnosed, degeneration of dopaminergic neurons has progressed, and the dopamine levels have reduced drastically. Some of the cardinal clinical symptoms are resting tremor, bradykinesia, muscle rigidity, postural instability, freezing gait, drooling, sleep disturbances, bilateral hand tremor, and difficulty swallowing. So, resting tremor, so bradykinesia is the slowness of movement. Gait is what you can see here as short shuffling steps. The person in this picture is uh, is undergoing gait. This is the difference in the posture, and bending and walking, and short shuffling steps are being taken. Tremor is resting tremor means even when your hand is rested, maybe on your lap or just on the table, your hand will start shaking. That is what resting tremors mean. Etiology or the causes of Parkinson's disease. So, as you can see in this picture, main reason is the reduction of dopamine. How is the dopamine being reduced? So, some of the major types of causes are idiopathic, familial, genetic, and environmental. Idiopathic is known for there is no known cause for Parkinson's disease. That is what idiopathic factors mean. Then there is familial. Familial means passed down from family. This can either be genetic or environmental. Genetic means these genetic defect in the gene is caused by a genetic single gene Mendelian disorder, which is found in less than 10% of PD patients. Some of the genes that are affected are SNCA, Parkin, LRRK2. So SNCA is alpha synuclein. Parkin is a gene which produces Parkin protein, and LRRK2 stands for leucine-rich kinase 2. And in the environmental factors, the main environmental factors are brain damage or the brain injury or prolonged exposure to various metals, radiations, or chemicals, or brain infection or alcohol use disorder. These are some of the common causes of Parkinson's disease. Then we come to the diagnosis. So there are two types of diagnosis that is done. One is imaging, one is imaging and clinical diagnosis. So in imaging, we have SPECT and PET. So what does SPECT stand for? SPECT is also known as DAT scan. It is the full form of SPECT is single photon emission computed tomography. Here you can see there is a picture that I've put here, DAT scan. This is a picture of a SPECT image, and here this is the normal person. This is the brain of a normal person, and this is of a Parkinson's person. You can see that because the dopamine level has reduced, the neuronal death has taken place, and that is why you can see that there are more dopaminergic neurons in the DAT scan normal person than in the DAT scan of patients with Parkinson's disease. PET stands for positron emission tomography. There are many imaging techniques, but I specifically took only these two because these are almost 80% accurate while giving the diagnosis of Parkinson's. Now we'll talk about the clinical diagnosis. So early PD is a diagnostic challenge with the existence of wide differential diagnosis that consists of disease that are not associated with nigral degeneration or striatal dopamine deficiency. The commonly used UK Parkinson's disease Society Brain Bank, clinical criteria has diagnostic accuracy of only about 80%. So here, to date, it is unclear why neurons die specifically, but there is enough genetic and environmental studies suggesting a multifactorial origin. Some of the so according to this, so now we're going to discuss the Parkinson's disease criteria. Mm, just a second. I am so sorry about this. I'll have to just share my screen again.
If it helps, if you can send me your presentation, I could also present it if it helps with the internet issues.
Okay. Do you want me to send it right
Or
now?
we
I
could
think.
cut.
Okay. Just. I think I'll send it to you. Just give me a minute. I don't know. There's some issue. I'm not able to change my slide suddenly. Just. I'm really sorry about this. Just give me a second. How exactly am I supposed to share this with you? You're mute. Just
Yeah, I'm just giving you my email ID.
okay. Okay. Cool.
Yeah. Sorry for the delay, everybody. Just it's very rainy in India right now, so everywhere the Wi-Fi is.
Okay. I'm able to change the slide. Yeah. Uh, yeah. Can you see it now?
Yeah.
I'm very sorry about this, guys. I'm just going to continue from here. So here, the UK Parkinson's Disease Society Bank Clinical Diagnosis Criteria. So there are three steps involved here. So the first step is the diagnosis. The second step is the exclusion criteria, and the third one is the supportive criteria. So only after these three steps are found out and seen in a patient, only then the decision is taken if a person has has the Parkinson's disease or not. So let's go through these. And the first step, as it's written, is diagnosis of Parkinsonian disorder, a syndrome. So here, at least one of the following should be present with bradykinesia. So bradykinesia is slowness of movement, and at least one of the following, which is muscular rigidity, 4 to 6 hertz rest tremor, and postural instability are important. At least one of these should be present in the patient. Then the exclusion criteria. Some of these exclusion criteria involve Babinski sign, which is extension or upward movement of the large foot toe. Also, there may be fanning of other toes. So I'm not going to discuss about these exclusion criterias because these are more scientific. And the third criteria is the supportive criteria, which is if you have three or more of these, you are it is sure that you have Parkinson's disease. So we already read about these, which is unilateral onset and rest tremor present, progressive disorder, and persistent excellent response to 70 to 100% of levodopa. And here, this is the assessment here, this is the chart that was made by Huen and York scale, and these are the 5 stages of PD. The 5 stages of PD are in the first stage or first phase. In the first stage, you have only one side of the body is affected, and, for example, tremor in one limb, usually with minimal or no functional impairment. Both sides of the body are affected, but posture and balance remain normal. And the third one, both sides of the body are affected. There is mild imbalance when standing or walking. However, the person remains independent. In the fourth phase, both sides of the body are affected and there is disabling instability while standing or walking. The person in this stage requires substantial help and cannot live alone. In the fifth stage or the final stage, severe or fully developed disease is present. The person often is restricted to bed or wheelchair unless aided. Prevention and cure. So, as we know that there is no cure for Parkinson's disease yet, a lot of scientists, including me, we are working on. I'm a student scientist, so we are still working on this, and there is still no cure for it. And awareness of the disease manifestations, the treatments, and the progressive long-term course of the disease is necessary for the optimal management of the cases. Though there is currently no proven definitive way to prevent Parkinson's, prevention studies show that the actions can be taken to reduce the risk of developing it. Tremendous progress has been made in understanding the neuropathology of PD and its progression throughout the nervous system. However, none of these treatments is curative. Until a cure for Parkinson's disease is discovered, medications, therapies, and lifestyle changes can help those with the condition live a better life. Now we're going to discuss the treatments. So treatments are divided into two parts. One is the pharmacotherapy and the surgical one. And here in the pharmacotherapy mostly means the drugs that are made to deliver, to reduce the dopamine, to keep the dopamine level intact, or to keep the neurons from dying. So there are two types of pharmacotherapies. One is the dopaminergic one and the non-dopaminergic one. And in the dopaminergic one, we have a levodopa. So levodopa is when so levodopa is used to manage the PD symptoms such as tremor, stiffness, and slowness of movement. When levodopa is taken orally, it crosses into the brain through the blood-brain barrier. Once it crosses, it is converted to dopamine, and the resulting increase in the brain dopamine concentration is believed to improve the condition and assist the movement disorders in PD. There are combinations of drugs that are also taken, and some of them are levodopa plus carbidopa and many other like these. Then we have non-dopaminergic treatments or drugs that are being looked for. So some of the common ones are caffeine and safinamide. And here, caffeine is a non-selective adenosine antagonist. An antagonist is an inhibiting physiological action that is taken by the drug against the formation of any other neurotransmitters. So, and caffeine, the safinamide is inhibition of sodium and calcium channels and MAOB activity. So here, symptoms of late stage PD respond poorly to dopaminergic therapy. The reason be an abnormalities in the other non-dopaminergic transmitters like acetylcholine, glutamate, and norepinephrine or serotonin. The surgical treatments are deep brain stimulation. So this is directly into the brain of the patient. And what happens in deep brain stimulation exactly? An electrode is placed into the target area and connected to the stimulator, as you can see in this picture. DBS is stimulates the effect of a lesion without necessitating a brain lesion. It does not require making a lesion in the brain and is thus suitable for performing bilateral procedures with relative safety. So recent advances in treatment. So recent advances in treatment are usually we had drugs taken orally or directly injected in the body. Here we are using gel like levodopa and carbidopa gel, which is called as duodopa. It is continuously delivered through tube into the intestine directly, which is a little invasive. And there are other agonists, which are dopamine agonists, and they are still in the trials, but will soon be in the market. Some of them are Pardo Prunox, which is in phase trial 3, and Lisuride from it's a form of a skin patch and already marketed in Europe. And has progressed to the phase 2 trials for all over the world, worldwide marketing. The future prospects. So, modifying factors that lead to the disease progression and in further delaying its disability are the key unmet needs to be addressed by the current and future research efforts. Repairing the brain cells lost from Parkinson's disease is a promising area of future treatment. This procedure replaces disease and dying brain cells with new cells that can grow and multiply. But neural transplantation research has had mixed results. Some patients have improved with the treatment, while others have seen no improvement and even developed more complications. There are multiple treatment strategies in PD research pipeline. Five potential disease modifying strategies that are currently in clinical trial include decreasing aggregation of alpha synuclein using GLP-1 agonists to decrease neuroinflammation, compensating for GBA mutations by enhancing lysosomal activity, inhibiting LRRK2, and inhibiting CAB1. There are no studies in PD with comorbidities. Comorbidities are when PD and any other disease which is replicating PD are there. So we don't have those studies till now. And there are many researchers that are looking into this area, and hopefully we will have more studies and more medicines made soon. What do we do when someone has Parkinson's? Be patient with them. Keep what you're saying simple. Have a daily routine with the patient. Don't argue or get frustrated so easily, and use humor if you can make the person with Parkinson's laugh, because this eventually leads to dementia. Make sure that the patient is getting proper care and that they need, and please learn about the disease completely. Some of the societies that can be joined are societies or institutes that you can join as a student researcher, as a graduate student, or a PhD student are AAN, NICE, EFNS, which stand for American Academy of Neurology, NICE, which is National Institute for Health and Clinical Excellence. EFNS is European Federation of Neurological Societies. These are some of the references that from which I got this important information to share with all of you. And thank you. I'm ready to take any questions that you all might have.
Thank you for that lovely presentation. It was absolutely fascinating. As it's been put in the chat, if you guys have any questions whatsoever, feel free to put them down and let's get to the question. While they're typing out the questions, I had one question. You had said that right now scientists are researching cures because there isn't really anything. But what are some of the approaches that people are thinking might be viable and might lead somewhere eventually one day? For
So till now, we don't. Yeah. So thank you for that question. And the thing is that right now we don't have a diagnostic or a cure for it. Like early diagnosis of PD, we don't have any of those, and we don't even have a cure for it. The only thing that we're dependent on are the medicines that we have right now, or the surgical treatment that I told you about. So these treatments, what they do is they just keep the medicines in level. Now what we want is we want a cure, but technically we can't have a cure for this disease because there are so many causes that we don't know about yet. And every cause is so different than the other. Every patient that you see is so different from the other, that you can't just have one cure for it. You will need like so many different cures for it. And apart from that, for the diagnosis, the early diagnosis, we are looking into a lot of biomarkers. As such, different biomarkers that we might have in our body, like maybe for example, let's take a gene and follow that gene, how that gene is changing, and how it is causing Parkinson's in a person. So in different model organisms, these are checked, and many experiments are going on in such way to treat, because that's one of the ways. So there are many different biomarkers like genes, or there are different pathways that are being seen of how protein and all of these. So yeah, that's.
Thank you. Any questions? Okay, we have one. Since dopamine is also responsible for motivating behavior, how does this affect someone with PD?
So PD is caused because the dopamine level is being reduced, and this also has a lot of difference in the behavior of a person, frankly, and motivating behavior. So the person eventually will be very less motivated, might fall into depression and stuff. So that is why we need to really take care of these patients and start giving them early medications as soon as we find out. So yeah, I hope that answers the question.
Uh, any other questions? Um, but thank you so much for the presentation today. It was really fascinating and very informative. I hope all of you have been enjoying Synaptic Hacks so far, and we will be posting this recording of all of our webinars onto the YouTube channel after this event is over. So thank
Great.
you so much for coming.
Thank you so much for having me, and this was a blast. And if anybody wants to ask me any question, they can email me, I guess. I will share my email ID with you all, and you all can email me if you all have any other doubts. So, yeah, that would be great. It was nice being here, and thank you so much.